what's the value for the, it's a membership model, right? So by paying an annual fee instead of having 2,500 patients, I have 300 patients. In some ways, it's a relationship and access. That's what patients primarily want. But it's also, all right, what else am I getting for the annual membership fee that I'm putting in? And so by having something like this, like the Sika body composition machine, in some ways it adds value to their membership. And they see, all right, boy, this is markedly different from anything else I've ever done. It just adds value to the membership. In some ways, this practice serves as a model for ingenuity and trying different things that, again, you can't really do when you're seeing 20 to 25 patients a day and just kind of rushing through a schedule. And some of it is actually listening to patients or members and hearing, what are the things they're interested in. So as I hear people who are more interested in prevention and wellness, who are more interested in longevity, who are more interested in wearables and data. I mean, I have patients who come in, of course, with, and I'm sure you see this too, with their information about their ring on their phones and everything. So it's like, all right, how can we incorporate that into our, and mesh that into our general practice, knowing that more patients are looking for this kind of information. And being at some different meetings, including some concierge medicine meetings, I had heard about similar machines or similar technology. And somebody had mentioned this to me, and I tested it out and said, wow, this is a really, really cool tool. How do I get me one of these? In fact, I'll tell you just a quick story. I part of this, of course, is role modeling for patients and being fit yourself and so on. And so, I do my early morning workouts and again, to try to be a good example to patients. And, at some point I was like, I feel like I've hit a little bit of a plateau. And so somebody said, hey, you should check out the Sika machine that these guys have down the road. So I got on it and I was like, man, what? I didn't get a gold on my true body score. Are you kidding me? So I called my wife the very next day and that night and I said, hey, I'm changing gyms immediately because I can't have that. So sure enough, the Sika body composition machine actually cost me quite a bit of money because it led me to have to pay for more expensive gym membership. But I'll be happy to say that, hey, you know what? I got my gold badge now. So there you go. I tie it in primarily with their annual physicals or their annual wellness visits. Not always, but many times it's just a natural progression of the discussion about their general health. And being in a concierge practice, I have more time to do that. So it's kind of built into the schedule. I will say that we don't charge for the measurements. It's actually part of our annual fee or the annual membership concierge fee. So again, kind of an added bonus, added benefit that adds value to the membership. So I kind of have that as part of the discussion when I set the agenda. I'm like, hey, these are the things we want to knock out today. And if you have an interest and you have time, let's go ahead and get your Sika measurement. And so sometimes I'll advertise it when I see them for a prior visit, or we have these monthly emails that we send out to patients about different topics about the practice once they sign up for their membership. And one of the emails has actually been about their Sika body composition machine, and to say, hey, this is something that we offer, and so ask me about it at your next visit, or email me if you have an interest. And we've had people who are reached out to do that. But yeah, I've kind of gotten my flow at this point. We do the measurement. I come out with their fancy colored printed printout in my new colored printer. I put it in my nice concierge folder, and I say, hey, let's talk about your healthcare portfolio. So here are your labs, here's the homework for the next visit, and now let's go over your Sika. And I kind of give them a quick glance as to what I think there's 6 main measurements that I track, which are probably similar to the kind of the nutrition and fitness layout that you guys have, but I kind of tweaked it a little bit and just kind of go over some, hey, here's body fat percentage, here's muscle mass distribution, here's your true body score, here's what it means. Let's track it together, and we'll talk about next steps. And most of the time, all you have to do is present people data and they'll self-regulate, right? They'll look at it and they'll go like, I'm not surprised. I knew this information. I knew I was a little over on my body fat percentile. I know that my legs are not as strong as my arms. I know what I need to do moving forward. And so a lot of times, just by showing them this, they already are in the, I'm going to make some changes moving forward. And I'm motivated to look at this again in 3 to 6 months and see where I'm at. The next step, of course, is right. How do you guide people in terms of the specifics as to, all right, how do you specifically need to make certain changes to tweak certain things? But I'll tell you, most of the time, just presenting data gets people headed in the right direction. For some people, it merely reaffirms that they're in a good place. Right? Some people, they tell me they work out 5-6 days a week and they're eating well and so on. And just say, hey, kudos. Let me show you where you're at. And for some people, goals are different. But in some people, it's like, you know what? If you just stay where you're at right here, and your body distribution curve and everything, you're in a good place. For other people, it is the, hey, visually, if I can show you that in your body composition chart, you're above that line. And if we can just work a little bit to, bring down body fat percentile, maybe increase your muscle and get you right over here, and that's a great point of conversation for people, where they say, you know what, you're right. I need to incorporate more HIIT classes or a little bit more cardio into my workouts to try to get there. And then in a few months, we'll be able to see if it was mission accomplished. So it does change a little bit of the dynamic to go from general discussions about, well, just, exercise more and eat better, to a little bit more specifics where it's like, you know what, no, a little bit more cardio. And you know what, I need to kind of watch my saturated fat content. I will say it's interesting, and by looking at some people's readings, you'll learn a little bit about not just other patients, but yourself too. But I have, it's hard to get a platinum, right? It's hard to get a platinum. And in some ways, the people who've gotten platinums, I'm like, you know what? I shouldn't be surprised that these people really are, really working hard, churning, and they have it in terms of the balance of exercise that they have, cardio, weights, strength training, and so on, but also their nutrition. And so sometimes it's just nice to reaffirm that, the things you're telling me really are true. Other people that, aren't quite there, in some ways, for some people, it's like, listen, it's okay that you're not there because the goal is not necessarily your goal is probably never to get to platinum. And that's okay. You're sitting in a really good gold spot. And so let's just talk about what your general goals are. And that can be reaffirming too. Kind of confirms that feeling of like, yeah, what I'm doing at the gym and what I'm seeing was reflected in the numbers, where before it was just a guessing game. I remember, just as a quick story, a few years ago, and this goes back to my comment about seeing 10 people in a week at different levels of fitness. I remember having a 20-something-year-old female who came in for her physical, and she's dressed in like her gym outfit, right? She's got her, outfit and her exercise shoes and everything like that. And, she's here for her physical, we do her physical, listen to her heart, listen to her lungs, check her reflexes, go over her labs, which again, she's 20-something, and fortunately all her labs were perfect, including cholesterol. She's got a normal blood pressure, and it's like, all right, well, good job, see you in a year. And she was like, that's it? Like, that's my physical? We're like, well, yeah, that's what we do in healthcare. And she's like, you're not gonna ask me to do burpees or, can I do, how long can I hold a plank, or can I do, a pull-up or that kind of thing? It just was such a, eye-opener in terms of like, God, she's right. Like, this is not the area that we assess in healthcare. And so you might be healthy, but are you fit? And you might be healthy, but are you, striving towards those factors that will lead you towards longevity and a better life later on as you get older. Not that this is 110%, but it's definitely a bigger step towards that, to be able to give people the information that, let's face it, some patients and some patients, members, consumers, whatever you want to call it, are looking for that. And I think it's time that we in healthcare start to provide some of that for them, rather than people having to go outside of their doctor's office or the primary care office to seek that information. Everybody's situation is different. The finances of your office are going to be different. Your reimbursement, again, I'm in a 15 years before this in a traditional fee-for-service practice. Now I'm in a concierge space. In my previous practice, 100% of our reimbursement was through medical insurance. now 80% of my reimbursement is through membership fees, right? So only 10 to 20% of it's now fee for service. So different world, but you cannot change the care delivery model if you don't change the reimbursement model. And so there's a big piece of that. So I'm able to partner with my health system to purchase this machine, and in some ways include it as part of the membership and the value. Other people might purchase a machine like this and say, hey, I'm still kind of in a transactional model, but there's ways of getting reimbursed for some of this stuff. Now that codes are changing and reimbursement changes, and insurance reimbursement has the landscape, seems to change almost all the time. And so looking at things of, hey, are there ways that we can get that we can bill and get reimbursed for some of this? That's not a barrier. That's a barrier that can be overcome these days, and it's something to look at. In some ways, I would say that if you know of somebody who has this technology within their practice, or for example, in our health system, the employee health programs had this. Go check it out. Go look at it, get on the scale yourself, test it out, see what you think. And that could be a nice way of confirming whether this is something that you would be interested in having in your practice. I'll tell you that, again, we're early on in our practice and we're still kind of building the airplane as we're flying it. But I will say that this has been the early success point. Has in large part, what's the difference between your previous practice and this one? This is one of the key components, and just adding this alone, I can tell feels different to patients who are walking in the door and spending time with us.